Right.
You can offer it.
And if you're thinking about a bundled payment at an academic center, there are some, facilities that say, okay, fine, or no, we prefer our, a la carte billed charges because that's how we make money. And I've seen county hospitals where they don't take bundles. They don't even contract with health plans because they say, no, if the health plan pays within 30 days, we give them a 5% discount. Otherwise, we are a county hospital and we bill what we bill and you pay what you pay.
Right.
So there are a lot of nuances with how hospitals view this, whether they're public, whether they're private, whether they're academic, whether they're with an integrated, physician provider network, and or have exclusive contracts with, staff employed physicians because, a lot of these hospitals, for example, have employed physician hospitalists and ICU docs and, how that factors into the bundled payment or not and or, rehab facilities, right? Because you'll have the surgery, but if you need acute rehab in a skilled nursing facility or an acute rehab, for a week or 5 weeks, that will, affect the way you do your bundled payment for your hip replacement. Because if you're saying it's going to include, 2 weeks for the pre-op eval, the date of surgery, and all of the rehab and care afterwards, obviously the inpatient stay will be, anywhere from 24 to 72 or 96 hours, but then the time in the rehab may vary from 1 week to 6 weeks because some of these elderly patients that were very deconditioned before surgery, will take a longer time to develop strength and stability to be a safe discharge at home. So, there is a lot of variability there, and how tightly, integrated the acute hospital is with the rehab or SNF, skilled nursing facility, is variable. And, is there home health that can do physical therapy? And, obviously that's a cheaper option and the hospital would be, benefited by, if they accepted a bundle payment, to have services provided in a lower cost setting. And how do you monitor that to ensure, you're getting the right outcomes and the financial incentives are aligned? So there's, some nuances there.
But my last question is, so it feels like when the energy for creating these bundles, when it comes from a plan, would be purely like this has just been a growing area. It's starting to, the spend is growing. It's almost like a form of cost reduction or stopping this growth. Like that's what's motivating it. It's pretty much like 90% of that. Would that be a fair statement?
Well, you're talking to a physician, so my bias would be that we're trying to standardize care, ensure quality outcomes, and contain costs. But yes, it's about ensuring quality and outcomes. And yes, I think if you do what's best for the patient, the financial, rewards will follow. We don't want patients to have complications and prolonged length of stays because bad things happen in the hospitals. They get infections. They have, DVT blood clots. They have, medication errors. So we want to, optimize patient care while controlling costs.
Yeah, so it's like a form of standardization of treatment. Okay. Kim or Rick, anything else from your perspective?
No, this has been a huge help as always. We always really appreciate the time.
Yeah.
All right. Well, thank you. Tell me, how are you going to use this information? Is it for designing investments in these companies or doing your due diligence?
Basically to inform diligence. I mean, so it's really looking at, for companies that provide these services that primarily help build and manage the bundles themselves from the provider side.
Okay.
It's really just trying to understand, is there going to be a healthy market for bundles? Is it going to get supplanted by any other type of value-based payment? And then really understanding across specialties how the company can, I guess, kind of identify which areas make the most sense to approach in terms of new bundles and new opportunities.
Okay. Well, best of luck with your project.
Yeah, thank you. Yeah, we'll be sure to reach out if we have any other questions.
Yeah. Thanks for helping us in the past too. Take care. Bye.
All right. Take care. Bye-bye.